Content warning. This podcast episode contains discussions of a sensitive nature that may be triggering for some individuals.
5, 4, 3, 2, 1. Let's go. Diary of a Kidney Warrior podcast in partnership with Kidney Care UK, sharing faith, knowledge, hope, and love.
Hi, and welcome to Diary of a Kidney Warrior podcast. My name is Dee Moore, and I am a kidney warrior. This podcast is dedicated to encourage, educate, and inspire as we explore all aspects of kidney disease, related chronic illnesses, and health. In today's episode, I'm joined once again by the brilliant Professor Ibi Erikasima. This episode is all about building understanding as we take an important first step into the world of hemodialysis. Whether you're new to dialysis, supporting someone on this journey, or simply looking to understand it better, this conversation is for you. Professor Ibi breaks down the basics and explains the hemodialysis process in a way that's clear, informative, and easy to follow. So let's begin this important conversation about understanding hemodialysis. Hi, and welcome back to Diary of a Kidney Warrior podcast. How are you doing today, Professor Ibi?
I'm very well, thank you. How about you?
I'm good, thank you. I'm really excited about our interview today. Listeners, this is now my third interview with Professor Ibi. The first interview together was episode 82, which was sickle cell and chronic kidney disease. The second episode, 120, the link between hypertension and chronic kidney disease in the Black community. And now today, we're going to be looking and exploring the subject of hemodialysis. Now, as a hemodialysis patient myself, I have a special interest in this topic today, and I'm really excited to learn more that can help me with my journey with CKD. So yeah, I'm doubly excited about our interview today. So I like to start from the basics. And so my first question is, what is hemodialysis?
Okay, hemodialysis treatment is one of the treatment we give to patients when they have what they call end-stage kidney disease. That means that their kidneys are functioning at a level that perhaps not really compatible with survival. So we need to give them that treatment to remove waste products and excess fluids from their body. And so what does that mean? They call it hemodialysis. Hemo means blood. And so what happens is that there's a machine called hemodialysis machine to which is attached a filter. And then the patient who was to receive the treatment now is connected to the machine through a needle is put into their vein or through a tube already in their major blood vessel in the neck. So through that, the blood flows into the machine and it now finally enters the filter, it is now filtered, and then the filtered blood gets back to the patient, while the impurities that comes out of that blood is passed onto the dialysis fluid and it's gotten rid of. So that is essentially hemodialysis treatment. It is usually used for patients who have advanced chronic kidney disease, who kidney function is gotten down to less than 7 to 8%. That's when, and then they're also feel unwell. And so we offer that treatment to them to make them feel better.
So essentially, you're taking someone's blood out, cleaning it, and putting it back into their body.
Exactly.
So today I really wanted to look at the different parts of hemodialysis, the different things that are monitored as a hemodialysis patient and why they're monitored. What is the significance? What are the benefits? What are the consequences if they're not? To really give somebody who maybe is just about to start hemodialysis, they're thinking about their first ever session, so that they can be empowered with information to help them. The first thing is a patient that when you arrive, they weigh you. What is the reason why patients are weighed before they start their session?
The reason why they are weighed is because at the commencement, they get what you call your base weight. It's another name for it. It's called dry body weight. Now, why do they call it dry body weight? Dry body weight means that this is the weight you have without fluid. And that's the target weight that they want to aim at all the time. Because if they don't have that weight, they'll be able to make comparisons as to when you've had excess fluid on board in terms of fluid retention. Because that's one of the commonest things that happen to kidney patients, because the kidneys can't get rid of water as it should. And so we need to have a target to measure it with. And that's why when she comes to the unit, they measure you. And why do they measure you? For example, if you came on dialysis today, or you finish dialysis, you came on dialysis, they will take your what they call pre-dialysis weight, and they take a post-dialysis weight. And they look at the pre-dialysis weight and to compare it with your target weight. And so that will determine whether you have fluid on board. And fluid is measured in kilograms. But also the dialysis machine can measure your blood volume, because some of the machines have that facility to measure your blood volume. So basically, the essence of the weight is to give an idea whether you have fluid that is retained in your body. And in between the days you did not dialyze, that will give them the reflection whether you've taken too much fluid during that window period that you did not have dialysis treatment. So, for example, if you had a weight of 60 kilograms as your dry body weight, as your base weight, which is your target weight, and then you dialyze on a Saturday and you come on a Tuesday, and they find that you are 5 kilograms above your base weight. And that means that you have 5 liters of fluid, that you have had. And the implications of that is not good for your heart. And that's why fluid management is very crucial in dialysis patients.
How do you, as a patient, know how much fluid that you are allowed to drink?
That will depend on whether you're still making good volume of urine or not. But there are people, as the treatment of hemodialysis goes on, in terms of duration, maybe a year, 2, 3, 4, they stop making urine altogether. And so in those people, they need to be very careful. But there are still some dialysis patients who still make good volume of urine. And so to answer your question, your fluid intake depends on how much urine volume you pass. Taking into consideration that all of us, whether we have kidney disease or not, have insensible loss through the skin and through our respiratory tracts. The insensible loss is about 700 mils. So what we say is that we kind of ask you how much urine do you pass? Or sometimes we do measure your urine over 24 hours. And that will determine the amount of fluid you can take. But for those that your urine volume has tailed off, your fluid intake must be less than 1 liter, which is later we're taking into consideration the insensible loss. And mind you, people take water, although you don't drink water, but your food contains water. So that is also taken into consideration. So the reality is that it depends on whether you're passing urine or not. And that's why for those that are passing urine, we are more lenient with their fluid intake, because they're passing good amount of urine and they are unlikely to have fluid retention or fluid in their lungs if they take too much fluid.
So the implication then, if people don't stick to their fluid allowance, and this is for them as an individual, so you can't look at anybody else and how much they drink, it really is about your urine output as an individual. So you mentioned that having too much fluid can affect the heart and can go onto the lungs. So that's serious if you're what we call overloaded because you've taken in too much fluid.
Yes, because what happens is that the implication is that, the heart is like it's a pump. So when you now overload the circulation, the heart begins to struggle pumping that. So what happens is that the heart, it kind of weakens the pumping function of the heart. And that means that you're likely to have pressure back into the lungs. And that's what causes breathlessness in patients who have fluid overload, in dialysis patients especially.
So what would you say then is the safe distance from your dry weight when you arrive at dialysis and you weigh yourself? How much over your dry weight is the ideal to be aiming for each session?
I mean, most people, if you take the context, if you're passing urine, good volume of urine, and you also know that you're eating food and all that. So most people will have what we call interdialysis weight gain of about 2 to 3 kilograms, which at least 2 kilograms will be susceptible, especially if they're passing urine. But if somebody is not passing urine and they have 2, 3, it becomes a problem for them because there's nowhere to get off that excess water. That's where will get retained, and that's why they become very breathless. So you can see that somebody has a long interdialysis period. Okay, I give an example of you dialyze on a Saturday, and then you don't come to dialyze until Tuesday. They come there, they're really struggling to breathe. And so for those that don't make urine, and so that they're not even restricting their fluid. And so what that happens is that the system that's the way of getting rid of the fluid. So the body circulation is now under stress to cope with the excess fluid in the system. And so what happens is that it goes into the various tissues, and the lungs is the first place to cry out. And it begins to show in your legs and your face and all that. Like I said, it all depends on whether you're still passing good amount of urine. And most times we give an allowance, when most people come with weight gain of about 2 kilograms, which is acceptable, 1 to 2 kilograms. Sometimes if you're passing good amount of urine, so you don't get dehydrated, some people can say where they get an allowance of 2 to 3 kilograms.
So ideally, we're looking at 2 to 3 kilograms. If someone consistently goes over that over time, that's going to cause a lot of problems, isn't it? So,
but there's a caveat there. Now, some people, as they dialyze, as they get out the toxins, their appetite improves. And some people actually gain flesh weight. So that's why they are reassessed all the time to be sure that the weight gain they have is not fluid retention. And that's why it's good to reassess their weight and all that. So you look at their pre-dialysis weight and post-dialysis weight and be able to adjust their weight. Otherwise, what you're going to be doing is that you will be removing too much fluid. And that also has its own implications. They'll begin to feel dizzy, their blood pressure crashes and all that.
So is a good way as a patient in terms of like keeping on top of your fluids and knowing what's going on in your body, if you look at your legs and you see that they're starting to pit, like you put your finger in and it's indenting or pitting or things like that, is that a good way as patients of keeping an eye on our bodies and knowing what's going on, whether we've got too much fluid?
Yes, I mean, it's an indication that it's taking too much fluid. And so I always say that the dialysis treatment is a two-way traffic, because you as a patient, those patients that take ownership of their care are the ones that do better on dialysis, because you're aware that it's not safe you'll be living in a miserable life where you can't do anything at all, but you live a sensible life and engage with your doctors on how best you can get treatment. But you have the responsibility as a patient to look after yourself, because most times that's what the work of the dietitian is. The dietitian would advise you on foods, fluid intake, and all that. Bear in mind that some people don't think that certain foods they take a bowl of soup. They don't know that is fluid. You take about 300 mils of soup, and you don't count that as an inclusive in the fluid intake. So it brings a bit of confusion in some patients. And so the fluid intake is holistic, it's food and drinks. That's taken into context,
So fruits like watermelon that have a high water concentration, cucumbers, things like that would also contribute towards your fluid allowance each day.
Yes, you also know that most of those fruits also contain all this potassium, sodium, and all of that. So You need to have conversations with your dietitian to be able to be sure that these foods are not going to cause problems. Not problems, that's visible, but it's not going to increase your level of potassium. It's not going to increase your level of fluid. It's not going to increase your level of other impurities like phosphates and things which give problems.
So you've weighed yourself now, you're being connected to the machine, and the nurse takes your blood pressure. Why are they monitoring your blood pressure?
Yeah, blood pressure management is very crucial. Now, I always say that kidney disease or the kidney is the seat of hypertension. Once you have a kidney disease, you're likely to have high blood pressure. Basically, the hypertension of kidney disease is so different. It's a combination of many things. The kidneys are producing some chemicals. We call it angiotensin, which it produces because it's diseased. Then on the other hand, it's not able to get rid of water and salt. So those two combined, that's why hypertension in dialysis patients is difficult to manage sometimes because of the combination of these two. But the mainstay of making sure that dialysis patients' blood pressure is well controlled is fluid management, because you retain water and salt because the kidneys are not getting rid of that. So this is known in the various research and literature that if people dialyze for long hours or many, many times, and they are dialyzed to their target weight, their blood pressures are likely to be better controlled than those who dialyze 3 times a week, But the standard way of treating patients worldwide is 3 times a week because the resources are not there to dialyze people every day, in most countries. In fact, in every country, because of resources. So the blood pressure is one thing that we take very seriously because it has its own consequences on the heart and the brain. Because those things that happen to patients is cardiovascular events. You have a heart attack or they have a stroke. So we're very, very careful about their blood pressure management. And that's also has bearing on their fluid intake because it's fluid, salt and water, and also the chemicals that are released by the kidneys because it is diseased.
So what can kidney patients do to take care of their blood pressure?
Okay, I always say that one of the things that you can do, simple things, is your dietary modifications, eat less salt, and adhere to your fluid restrictions, those sort of things. And then take your blood pressure medications. I also encourage patients to do what they call self-monitoring at home in between dialysis. Because home blood pressure reading has been found to be useful in blood pressure management next to 24-hour ambulatory blood pressure monitoring that you get. Because I always say that the blood pressure you just measure in the hospital sometimes is when patients just arrive, you just take their blood pressures. Sometimes it's not a good reflection of their 24-hour blood pressure profile or when they are at home and relaxed. So what I will advise is you look after your diet, salt and water, fluid management, and ensure that you take your medications, and also be proactive with your blood pressure checking if you're concerned about that. Or even as a habit, you can check your blood pressure.
And what is a healthy range of blood pressure for hemodialysis patients?
That is a very good question because the target control is not same as the general population. The blood pressure levels in dialysis patients is slightly higher, and there's still a lot of controversy on that. But we've come to a consensus. If you get a dialysis patient with a blood pressure of 150 systolic, is reasonable blood pressure. So if you compare it to the general population, for example, somebody that is uncomplicated hypertension, of course, the target is 130/80. You understand. But in dialysis patients, it is different because there are too many factors that are involved. And to deal with every factor, for example, you get to remove fluid through ultrafiltration on the machine and, all the things involved with blood pressure that contribute to the blood pressure increasing. So we've come to realize that getting people to blood pressure level of 130/80 is very difficult. So the consensus is that if you get a blood pressure 140 to 150 over 80 to 90, it's acceptable. And there's also enough evidence that even without blood pressure, it's likely to cause other consequences, cardiovascular disease and all that. So it's different. So the take-home message here is that it's different from a target in the general population.
The flip side of that then, if a hemodialysis patient has low blood pressure, what is the implications of that?
There are many factors that cause that. Either one is that the patient is being overdialyzed. I mean, they take too much fluid, and so that drops the blood. So it's possible that the patient is being dialyzed below their dry weight, and so they need weight assessment. All right, so that is one. Number two is that in some patients, they are dialyzing so well that we need to knock off some of their blood pressure tablets. So that is number two. So first of all, you look at their dry weight, and I reassess it because they'll probably be overdialyzed or just to be given ultrafiltration while they don't even need to remove any fluid at all. And then secondly, like I said, is to see that they're being dialyzed properly, so which meant that they need less blood pressure medications. So you need to review their medications. So number three is that for those that have poor pump function of the heart, their blood pressure will be naturally low. Those have had already established cardiovascular disease, who have low blood pressure. So that is taken into context when we're managing their dialysis treatment. Those group of people are difficult to manage because, if you don't give them good dialysis, they will get poorly. But on the other hand, their heart is not enough to take the rigors of dialysis. So their blood pressures are always low. So those are the main things to think about.
One of the things that you see on the screen when you're doing hemodialysis is the pump speed. What is the significance of the pump speed?
The pump speed is what creates the pressure in the membrane. Because if there's not enough speed, it won't be able to build up pressure to force the impurities through the filaments in that little kidney that is attached. We call it kidney, it's the dialyzer. Yeah? So if there's not enough pump speed, dialysis you will not have adequate dialysis. In other words, what I mean is that there won't be movement of solutes like potassium, sodium phosphate and things. So those things continue to accumulate if you don't have good pump speed. Because the pump speed is what creates the pressure that allows the dialysis, the exchange of impurities across the membrane to make your blood cleaned up happen.
So ultimately, you need a nice high pump speed to create that pressure so that your blood is cleaned properly. So what is the ideal pump speed?
I mean, the pump speed usually that we recommend, most people have a pump speed of at least above 350 mils per minute. So, but there are some people that can't tolerate high pump speed because the pump speed also will depends on your cardiovascular health. If your heart is not able to, because if the blood is going fast, going back to the heart and the heart is pumping it, but it's pumping forwards, you're pumping backwards through the machine, that is going to really stun the heart. So that is the downside to very high pump speeds. So most times we settle for a pump speed of about 350 to 400. That would be ideal. But sometimes for those that are just starting dialysis, we don't start with very high pump speed that they can be able to tolerate the dialysis treatment. So we probably start with 250 and then build up to 300 and then build it up.
Sometimes you can experience really bad cramps when you are having a dialysis session. And when I say bad cramps, I mean excruciatingly bad pain. Why do you experience cramps when you're doing hemodialysis?
You see, when you're dialyzing, there's a shift of salts. Because there's so much impurities in your blood, the shift is what causes. There's a shift in equilibrium. That's what causes those cramps. And also, when patients are fluid overloaded, if you take too much fluid and there's a bit of high ultrafiltration because they have too much fluid on board, it can also cause cramps. So two things: salt driven, because there's movement of the salts across the membrane from your body because your body is accumulated salt because your kidneys can't get rid of it. And then secondly is that if somebody who has been nauseous and taking too much fluid, and fluid is just, the machine is just like a computer that just senses that there are sensors that say that this blood volume is high. It will ultrafiltrate more. And so that will cause cramps. And if you notice, if you just take extra fluid, maybe take extra, and you see that when you're dialyzed, you see yourself that you're getting too much cramps, it's because of extra fluid on board.
One of the strategies that I have found that's helped me personally avoid cramping is to adjust the amount of fluid that is taken off. So it alternates between higher and lower throughout the session. And for me personally, that has really helped. Why does that help?
I would say that I can give a scientific explanation to that, but possibly. I always say that dialysis is individualized treatment, so sometimes some people can tolerate certain ways of treatment. Some people cannot tolerate certain ways of treatment. But I have patients who do just 3 hours and they're well, very well. I have a lady that does twice a week and she's done twice a week for many years. And so it all depends and she's tolerating it. I don't know whether sometime that will break, but for now she's doing well. She's done well for a couple of years and her figures are good. So coming back to your question where you can adjust your ultrafiltration, that is you. But the general rule is that if you take too much fluid on board, you're going to get more cramps. That is, it's a known fact. And so sometimes what we'll do is that when that happens, they tend to discontinue ultrafiltration and then allow things to settle. But because if they don't take enough fluid, your fluid will accumulate to the next one. So that's how it keeps accumulating until you see yourself that's natural. You always have 2-3 liters on board, even after dialysis. And so you may be requiring extra dialysis to get the fluid out, to get to your target weight.
Well, speaking in my case specifically, it alternates, but I still reach the target I'm required to take off. So it doesn't actually, in my case, again, we're talking individual cases, but that's not the case.
Okay, good. But you should also understand that it is driven by fluid. Cramps. Yeah. Actually, that's the take-home message here. When you take too much fluid.
So really reinforcing the message that stick to your fluid allowance because it has so much negative implications if you're overloaded, and especially if you're consistently overloaded.
Yeah, that's correct.
The other thing that I've unfortunately experienced once, and I have seen many times other patients have, is a crash on the machine. And when we use the word crash, it certainly has different implications. But in this instance, when we're talking about hemodialysis, what is a crash and why do they occur?
A crash happens when, again, go back to fluid overload. So patients come in and they're fluid overload. So the machine is what you put in, you understand. It also filtrates them to the point that it drops their blood pressure within 30 minutes. And so you got to give them fluid. You can see how that is very distressing for the patient. But it's also not good for the heart. Because what it does is that it stuns the heart, because when your blood pressure drops, the blood supply to the heart muscle itself diminishes. So it stuns it. So it is not a good thing. And that's why it goes back to the same point of fluid and salt and water. So you got to be very mindful of your fluid intake and all that. There are certain measures that we take. There are some patients that can't tolerate hemodialysis. And so what we do is that we balance their dialysis by kind of combining filtration to the dialysis in the sense that we use fluid to give them as we're dialyzing them because they're not able to tolerate ultrafiltration. Yes. So, but the message here is that what causes crashing in blood pressure primarily is when people are fluid overloaded, and the first 30 minutes, the machine just gets so much fluid out of them that their blood pressure crashes.
So reinforcing yet again the importance of sticking to your fluid allowance and making sure that you're not overloaded.
Yeah.
You touched on this slightly, but I really want to talk about this a bit more. And generally, people attend dialysis 3 times a week for 4 hours. Now, 4 hours is a really long time, and over time can be quite a burden to be sitting there connected to a machine for 4 hours 3 times a week. Why are hemodialysis sessions so long?
If you look at the hemodialysis treatment, hemodialysis actually does 10% of what the normal kidney does. And in the real world, if you want to mimic the kidneys, you should be having daily dialysis. But that is not affordable by any country because dialysis is an expensive treatment. Over time, they've calculated the minimum that you can get to stay alive, which is 10% of what the kidney does. And so that means it's 4 hours 3 times a week. And that is the standard across many parts of the world. And there are some people, because of their low, small body mass and things, they're not able to tolerate 4 hours. We can reduce it to 3.5 hours. So those patients, you have to keep a close monitor of their fluid status because that's one thing that will get them into hospital with fluid overload. So there are certain centers in France where they've done dialysis every day for 6 days or 7 days. And patients were almost not on any medication because their phosphates were under control, their potassium under control, their fluid under control. So their blood pressure is under control and all that. But that is not sustainable in this day and age in the economy of what we find now in terms of providing dialysis access to everybody. So the thing here is that dialysis is 3 times a week, 4 hours in each treatment. Unfortunately, that's not something that you can change because it is important to clear those impurities, those bad salts and excess fluid in your body for you to feel better.
It really shocked me what you said, that the recommendation where you're doing dialysis 3 times a week for 4 hours is literally only 10% of what your native kidneys would actually be able to do. So for people who think that 4 hours 3 times a week is way too much, in reality, it's the minimum that we should be doing as kidney patients, in reality.
Yeah, that's correct.
So what is the implication over time? If somebody, they said, I've had enough, and they finish their sessions early every time. And so instead of 4 hours, they may be doing 3.5 or 3 hours or less over time. Or there's patients who don't want to turn up for sessions, and so they miss sessions here and there. Over time, what is the implications of having less dialysis?
Okay, the implications are mainly 2 things. One, there will be accumulation of salts, and the one that is dangerous most is potassium. And I've seen patients who have arrived to the dialysis with a potassium of 8. That can stop your heart. Yeah, in my experience. And fluid overload. Those are the 2 things. I mean, those are the 2 things that are not, that cause fatality in patients who continuously refuse to come for the dialysis or consistently under dialyzing. You see that over time, your potassium begins to build up and your fluid retention worsens. And all the various salts will continue to accumulate and you'll be feeling really unwell. So it is not a good thing not to dialyze properly. When I started my career as a nephrologist, way back in the late 90s, some of the treatment now were not there. The dialysis machines were not as friendly as they were today. So there's been advancement in dialysis machines. I mean, look at the machines, they can even measure blood volume, they measure all sorts of things to alert the doctor, So I think dialysis treatment has really progressed from when I started my renal career way in the 2.5 decades ago. So people are surviving. I have patients who have been on dialysis for more than 10 years and they're still looking well because for some reason they couldn't get a transplant either because of their match, the kind of antibodies they have and things like that. So I've had patients who have been on dialysis. I remember one went to a renal meeting 2 years ago as somebody who has been on dialysis for 30 years. So it all depends on how you look after yourself. And now there's home dialysis. When I started renal medicine, there was no home dialysis. Now people can dialyze themselves at home. So things have progressed in terms of dialysis. Even the technique of doing fistulas to ensure that you got dialysis treatment has also really improved over the years.
Quite often after dialysis, you can feel really wiped out, like a bus has hit you. Why is it that hemodialysis has such an impact on the body?
When you go on hemodialysis, what it does is that there's a shift of solutes and things. And I will say that hemodialysis is like a consistent inflammatory process because your blood goes into a circuit and comes back to you like that for that length of time. And for most people, there's a bit of a stress on the body, although it makes you better, but it also makes you feel fatigued, especially like sitting in one place for 4 hours, having a particular treatment will also have an effect on your general body, just sitting there, that sense of fatigue and all that.
So what are the advantages and disadvantages of hemodialysis?
Okay, like every other thing, like every treatment has its pros and cons. So the advantage is that you have a 4 days dialysis free days. For example, if you dialyze Monday, Wednesday, Fridays, you have dialysis free days in between, which you can just do other things that you love to do. And secondly, there is always professional support in the dialysis unit, so that's something good. And you can also do it at home. Can be trained to do it at home, especially those that are not needle phobic. You can do it at home if you get training. I mean, I've seen people who are managing themselves for many, many years. And also during the hemodialysis, for example, if you're on EPO, you don't need to jab yourself subcutaneously. You're giving through the machine. You're having iron infusion, it's given through the machine. And so, those things you get it during treatment. But if you're at home, if you have to give it to yourself, those that are doing center dialysis. Now, the disadvantage is that there are a lot of food restrictions, so that is one thing that is more against it than compared to peritoneal dialysis. Okay, so secondly, there is catheter-associated infections. And if you get a good going infection, it's awful. Patients are really very sick. I've seen even patients who have had bad septicemia, even damaging the valves in their heart. I've seen that. So that's the extreme, So that's why we advocate that don't use catheters for too long. We always advise that you get a fistula done. A fistula means that they reconstruct the blood vessels in your wrist or your elbow so that you'll be able to needle that particular blood vessel and for enough blood flow to get into the machine. So because hospital-based treatment, for most people, although there's home dialysis now, but very few people are on home hemodialysis. Not many people. So it's predominantly a hospital-based treatment. So which meant that all the time you're in hospital environment. But what is happening in some parts of the world is that even in America and even you have dialysis centers in shopping malls. Yes, in America, yeah. Some dialysis units are not within the hospital, they're outside the hospital. The dialysis unit which I look after is near the Oldham Athletic Football Stadium. it's not within the hospital. So when patients are unwell, we just like them, get ambulance to get them to the hospital. So you can put dialysis units in kind of community centers where people don't feel that every week they're in the hospital having dialysis. So that also puts off patients, that they're in the hospital environment all the time. And the tiredness post-treatment is also a negative factor. And the long, like you mentioned about the long hours of treatment, 4 hours, 3 times a week. And sometimes patients' blood pressure crashes because of the rapid fluid and metabolic and salt shift when you're dialyzing as you come in and all that. And also there's bleeding risk because they use blood thinners to put in the circuit so that the circuit doesn't get clotted and all that. So you could have, after dialysis, you could have, when they remove the needle, you could have some bit of bleeding. And that may not be hovering well with your blood count and all that. So those are some of the disadvantages. But essentially, it's a supportive treatment that keeps you alive. And so when you look at the care of balance it too.
So what can patients do to help ensure that they have a good dialysis session?
I think what they can do is to, I always say that dialysis treatment is a long-term treatment until you get a kidney transplant. And so you have a partnership with the healthcare professionals that look after you. And so what do I mean by that? So you rather than being reactive to your treatment, be proactive to your treatment. And so you do the things that will make you feel better and listen to the advice. And I always encourage my patients to go the direction of self-care. So in fact, even to the point that when they come, they are the ones that wipe the card for their weight. They don't wait for the nurse to come and weigh them. They go there, weigh themselves and give the figures to the nurse. And it goes there, they begin to even prep their machines themselves. So in that case, you're taking ownership of your treatment. So in that way, you're not looking at your treatment as every time feeling sorry for yourself. And that's generating that sense of self-pity all the time. So you engage with your treatment. That's the point. And work with your healthcare professionals to keep yourself better. So that's what I can say. Yeah.
Is there anything else that kidney patients need to consider when they're on hemodialysis?
Yeah, I think one of the things that I see most patients do, they bring very heavy lunches and things. And one thing that does is that you should remember that when you eat food, a lot of food, blood flow goes to your tummy. And so that could crash your blood pressure and in the midst of the treatment. And so what we do advocate is that eat something light and so that you don't get that problem. So it's not as if you're not going to have something to eat or eat something light, but some people seem to come with heavy meals and they tend to crash their blood pressure and begin to be sick.
So when you say something light, can you give us an example?
I mean, you can eat a sandwich and a cup of a drink or something. So most times you won't take more than 150 mils anyway on dialysis. So a sandwich will do. And sometimes like in my own center, they give them biscuits or sandwich or something. So with a cup of tea or if they want to drink water. Sometimes some of them come with their meals, but we always advise them to come with something like a sandwich.
So today we've looked at what is hemodialysis, we've looked at dry weight, fluid restrictions, blood pressure, pump speeds, cramping and crashes, why sessions are the length that they are, why hemodialysis is hard on the body, the advantages and disadvantages of hemodialysis, and what to eat whilst you're on dialysis. What is your final word of encouragement for the listeners?
We all know that advanced kidney disease is an awful disease, and the treatment modality is a bit invasive, especially hemodialysis, where you have to use a needle to put into the vein to get the blood out, to get your blood cleaned up. Things have really progressed in terms of how the machines are getting better for your body physiology. And so I think working with your healthcare professional, that's your kidney doctor and the nursing team, dietitians, or the multidisciplinary team will really help you get the best out of your treatment. And so that's what I will encourage people who are on dialysis. That's what to do. Work with your healthcare professional. They're there to make you feel better, and hope to get a kidney transplant if you're suitable to have that, and you just get on with your life.
Thank you so much for joining me. Thank you so much for the information that you've shared. I've learned so much in this interview that will help me personally, and I know that this will help so many people out there. So thank you so much.
Yeah, my pleasure, always. Thank you for having me.
Thank you for listening to Diary of a Kidney Warrior podcast. I truly appreciate your support. New episodes of this podcast are released every other Monday, so make sure you subscribe so you don't miss future episodes. And if you found this episode helpful, why not share it with someone who might benefit too? To stay up to date with the latest episodes, news and resources, sign up for the email mailing list and join the WhatsApp channel. All the details are in the episode description. Until next time, take care and choose to live.